everybody. My name is Sarah Edwards, and I'm a respiratory therapist here at Island Health. One of my big passions is pulmonary rehab and especially respiratory education. So today we're going to be doing some education on COPD. So what is COPD? COPD stands for Chronic Obstructive Pulmonary Disease. COPD is characterized by narrowing of the pulmonary airways, which limits airflow going mostly out of the lungs, but sometimes in. So what are the causes of COPD? This probably won't surprise anybody, but the main cause of COPD is smoking. You can get COPD through environmental factors such as secondhand smoke, pollutions, and chemical fumes. And rare, but you can also get COPD through genetic causes called alpha-1 antitrypsin deficiency. And before we move forward, I want to discuss COPD because it is an umbrella term, meaning there are multiple different conditions that lie under COPD, one of which is chronic bronchitis, bronchiectasis, and emphysema. And though not generally characterized as COPD, asthma and cystic fibrosis are obstructive conditions of the lungs, meaning it's difficult for folks with asthma and COPD to get air out. Well, most people that come in with these symptoms can get diagnosed with COPD. Most of them are going to come in with some type of cough, sometimes with mucus, sometimes not. Shortness of breath is probably one of the most common symptoms of COPD. Sometimes it will be wheezing, sometimes fatigue. In some cases, if the oxygen level is at the point that it's low, there can be some bluish tint to the fingers or the lips, and occasionally swelling in ankles can be a symptom of COPD. So because COPD is a very common condition, there are lots of therapies and treatments to make you feel better. One of which is oxygen therapy. Others are bronchodilators and steroids in the form of inhalers. Breathing techniques can really help you feel a lot better. At some points in your treatment, you might use antibiotics. Because I have also a passion for exercise, and this is such an important treatment for COPD, we'll talk about pulmonary rehab. So there's 3 different types of inhalers we'll talk about. One is our meter dose inhaler. These are very commonly used. If you take your inhaler and you just spray it in the air, you'll notice how far that medication goes. If we put this directly into our mouth, most of that medication is going in the back of our throat or swallowed, and we need this medication into our lungs. This is why it's so important to use your inhaler correctly. One thing that every respiratory therapist is passionate about is the use of spacers with your meter dose inhalers. The spacer is a clear chamber that your inhaler goes into. It holds the medication in this space so you can inhale it. When taking your meter dose inhaler with the spacer, shake your canister, take a slow, deep breath out through your mouth, squeeze your canister while your mouth is around the spacer, take a slow, deep breath in, hold your breath for 10 seconds. The next type of inhaler I want to discuss is Respimat inhalers. These are one of the newer type of inhalers around. These are an inhaler that produce a much finer mist than meter dose inhalers, which help with the deposit of the medication. I want you to think of top. You're going to turn it, open the lid, and press, and you will see your medication come out. You can use these directly in your mouth, but these can also be used using a spacer for better deposition into the lungs. These are used very similar to the meter dose inhalers. Dry powder inhalers are another medication that are used. These are used much differently than the meter dose inhalers. These literally have a dry powder that you need enough force to pull with your lungs. So with the dry powder inhalers, you're going to exhale through pursed lips, but do not exhale through the inhaler itself. This will blow your medication out. We need the medication into our lungs. So remove the cap, add our loaded medication dose. Sometimes this is by adding in a pill, or sometimes simply just pushing down on the canister loads of medication. You're going to exhale completely through the mouth, place your inhaler in your mouth. This time you need to take a quick, deep breath, again pulling enough force with the lungs. Hold your breath for 5 to 10 seconds, and then exhale through pursed lips. The next way to take respiratory medications is through a nebulizer. A nebulizer is a machine that turns liquid respiratory medications into a fine mist so that it can be inhaled. Your respiratory medications will come in a pre-filled liquid dose that is poured into your nebulizer cup. Nebulizers are very helpful if you have difficulty taking deep breaths or having difficulty with hand coordination with your meter dose inhaler or dry powder inhaler. A full nebulizer treatment takes about 10 to 15 minutes. Breathing techniques can greatly help your shortness of breath. These can be used at any time or if you're exercising. The first breathing technique I want to talk about is pursed lip breathing. As I've discussed, people with COPD have a hard time getting the air out. It can sometimes feel like in, but the big issue is getting the air out. So pursed lip breathing is a really great breathing technique to help get that trapped air out, so then the next breath can be much deeper. It also helps increase your oxygen level, helps your shortness of breath, and it helps you slow down your breathing. So how do we do pursed lip breathing? It's very easy. You're going to inhale through your nose for 2 seconds, purse your lips like you're blowing in a candle, exhale through pursed lips for 4 seconds, and repeat as needed. I like to remember, smell the flowers, blow out the candle. Really, the goal here is to have your exhale twice as long as your inhale, getting that trapped air out. With diaphragmatic breathing, you're going to sit comfortable in a chair, or sometimes people will do it laying in bed. It's a really great way to wake up in the morning and go to bed at night. It's very relaxing. Place one hand on your chest and the other on your abdomen. Inhale through your nose. You're going to push your abdomen out when you inhale. This is going to engage the diaphragm and the abdomen. Exhale through your mouth and squeeze your abdomen in. This will engage your diaphragm and your abdomen. At times, people with COPD can have lots of secretions. This varies from person to person and with each diagnosis. But if you are somebody with lots of secretions, there are lots of techniques to help you. The two we'll talk about today are the huff cough and the controlled cough. Regarding a huff cough, this is a really great low energy way to clear secretions. For anybody that's had to cough quite a bit to clear secretions, it can really take a lot of energy. This is a really effective way to clear secretions that uses a little bit less energy. What you're going to do is take a deep breath in through your nose, exhale through an open mouth, making the sound 3 times. The ha sound is as if you were fogging up a bathroom mirror. Progressively increase the intensity and strength of your ha, if needed, until secretions become loose. Soon, the secretions will move from the smaller airways into the larger airways, in which it'll be much easier to cough up. The next coughing technique that I like to teach is controlled cough. This method takes a little bit more energy, but it can be a little bit more effective. You're going to sit in a chair comfortably, place your arms across your waist, inhale deeply through your nose, and as you exhale, you're going to bend over slightly and cough 3 times. This allows your diaphragm to assist with the removal of mucus. At any point in these techniques, if you're feeling a little bit dizzy, just pause what you're doing and take a deep breath. Exercise is a very important treatment for COPD. You may think somebody who is having difficulty breathing, the last thing you'd want to do is exercise because it can make anybody short of breath. But really, it's one of the easiest things you can do to make yourself feel better. Think of the downward spiral of dyspnea. Dyspnea is a fancy word for shortness of breath. When you have COPD, you're short of breath, as sometimes this can make you live a more sedentary life. This sedentary life leads to more deconditioning, and that deconditioning leads to more shortness of breath, and this is just a downward spiral. The good news is you can go up that spiral simply by doing exercise. It can be very difficult to know how to start with exercise if you have COPD and shortness of breath. Really, the best way to go is slow. I highly recommend getting a pulse oximeter because this will show you if your oxygen is dropping or not, and then starting off very slow and making small progressions throughout there, whether it's going longer time or maybe faster pace. If you do have COPD, Island Health is a great place for you. We have a lot of programs to help you feel better.